Muted. Um, what I'm going to do now is start to introduce our guest speaker for the day. Today, we're going to be talking about oral health, and we are joined with James Garlick from the Department of Psychiatry at the University of Michigan. He is the project manager of the Oral Health Project. After James finishes speaking, I'm going to share my screen. We have 2 oral health module videos that we're going to stream for you today. This will be recorded. If you need to check out early, you can find it on YouTube later. Please stick around until the end. We will be sharing a webinar survey link so that you can click on that, finish the survey, submit it, and then we will send you a certificate of completion so that you can upload that CEU to your profile in the registry. Please give us about 1 week to get those certificates to you. And last but not least, the Bridging the Gap webinar tomorrow for 2 CEUs is at 1 p.m. to 3 p.m. And that's sponsored by DWIN, DHD, and MiCHWA. And then our next webinar is on June 4th, which is our Safe Sleep Infant Death Prevention webinar. So stay tuned for those. And now I'm going to pass it over to James.
Thanks, Portia. Hi, everybody. Dr. Lapidos and Dr. Rowley, the project investigators, were actually unable to join us today, so I'll be filling in to introduce these modules and try to answer any questions that you might have to the best of my ability. If there's a question that I can't answer, I'd be happy to write it down and follow up with Dr. Lapidos and Dr. Rowley, and then reach back out to the group with those answers. Just to provide you some background on those project investigators, Dr. Adrienne Lapidos is a psychologist at the University of Michigan Medical School, Department of Psychiatry, and Dr. Danny Rowley is a dental hygienist at the University of Michigan School of Dentistry. So these modules are an online self-paced educational modules that teach basic concepts related to oral health. They were designed to improve the oral health literacy of community health workers and certified peer support specialists. Although any health worker without training in oral health may benefit from these modules. These modules were developed using community engaged methods to meet the needs of lay health workers. So module topics include oral health self-care basics, such as toothbrushing, flossing, fluoride, nutrition, and healthcare basics, like regular preventative dental care and dental home, and health promotion strategies. So for example, messaging that it's never too late to make changes, addressing oral health stigma, and emphasizing hope and recovery. So these modules were launched in July of last year and were evaluated between July 2020 and March 2021 using pre, post, and 3-month follow-up surveys. We are currently in the process of wrapping up the data analysis and should have a flyer of results that we can pass around to anyone who's interested. Yeah, so that's all I had, Portia. Oh, you're still muted.
Thank you, James. It happens to us all eventually, right?
Yeah.
You have to have good karma by telling other people that they are muted in hopes that someone will tell you quickly and expeditiously if you are muted. So we've got some questions. If you drop off the call, we're going to try to send a mass email out with the link to the webinar survey. If you don't receive it, just send a quick email to info@michwa.org and we can forward that to you. But for now, what we'd like to do is make sure we've got a couple people in the waiting room. Let me get them in first. Alrighty, so what I'm going to do now is I am going to share my screen, and then we are going to start playing the modules. I want to make sure that I'm sharing my sound. And again, please mute yourself if you're not already muted. I can hear a couple people are not. And please save your questions for the end. The first video is about 20 minutes long. The second one is just about that long, maybe a few minutes longer. And then James will be here the entire time to help answer any questions that you might have about these training modules.
An introduction to oral health. In this lesson, you will learn the basics of oral health, You will understand common dental problems and how to recognize them, and you will learn what people can do to prevent these problems. Perhaps most importantly, you will gain a new appreciation for the importance of oral health and quality of life, and new ideas for roles you can play in supporting the oral health of others. You'll notice a special feature of this lesson is that there are few opportunities to pause and consider what you would do in particular situations. When a "what would you do" slide comes up, feel free to pause and consider what you would do in these situations. In this section, we will talk about the role of oral health in quality of life and review the interconnections between oral health, whole health, and mental health. Oral health matters, and it matters all across the lifespan. But many people, even healthcare providers, do not have a deep understanding of the importance of oral health. This is one reason why the U.S. Surgeon General report on oral health called dental disease the silent epidemic. Let's start with oral health in children. Many people think that caring for baby teeth isn't important because they will fall out anyway. Unfortunately, this isn't true. Dental cavities is the single most common chronic childhood disease, 5 times more prevalent than asthma. Tens of millions of school hours are lost each year due to kids' dental illness. Pain from oral health problems affects children's ability to stay focused in school, and it affects their self-esteem when their teeth are visibly decayed. Baby teeth are space holders for adult teeth, and losing baby teeth prematurely affects speech development. Adult oral health is tremendously important too. Employed
That is
adults
fucking ridiculous.
million work hours each year due to dental disease or dental visits. There is research showing that employers sometimes discriminate against hiring people with visibly decayed teeth. Among adults, visibly decayed teeth is associated with shame and social impairment. Some even report that they avoid smiling and laughing due to shame. Imagine what effect it has on people's mental health when they are actively trying not to smile or laugh with others. Oral health is even important for people with no teeth. 30% of adults 65 and over have lost all of their teeth. Some believe this is just normal part of life, but that isn't the case. Tooth loss is preventable at any age. Gum health and denture care continue to be important even after people have lost their teeth. Just think about nutrition as one example. Without teeth or with badly fitted dentures, chewing nutritious foods becomes more difficult. These are just a few ways that oral health matters, and this is why your role is so important to help others and to help other people to see that oral health matters too. For historical reasons, dental care is separate from medical care in the United States. Many now see this separation as a mistake that has had negative consequences on health. We know that oral health is deeply connected to systemic health. Poor oral hygiene and untreated dental diseases are linked to serious illnesses like pneumonia, heart disease, and diabetes. It is also linked to problems in pregnancies. Recent research has even shown that simple gum therapy in a dentist's office can actually improve outcomes related to diabetes, heart disease, lung disease, and pregnancy. Helping people understand that their oral health affects their whole health is one important role you can play in supporting the people you work with. Despite progress by healthcare systems towards integrating mental health in primary care, oral health is often left out of the picture. Remember how kids with decaying teeth face self-esteem problems and that many adults with tooth decay avoid smiling and laughing due to feelings of shame? These are just a few reasons why oral health and mental health are connected. And there's more. Research has shown that people living with psychiatric disabilities have a greater risk of oral disease and have greater oral treatment needs than the general public. But despite their greater need for oral health care, many people living with psychiatric disabilities avoid dental treatment due to concerns about mental health stigma and perceived lack of access to affordable care. Overall, the basic picture is that there are deep connections between physical health, mental health, and oral health, but our healthcare systems sometimes treat these issues separately. Take a moment to consider how the separation of primary care, mental health, and oral health has negatively affected people's whole health. How has the separation affected the people you work with? How has it affected you? Here is an opportunity to pause and consider what you would do. A parent mentions that their child has a toothache. Since it's just a baby tooth and will fall out anyway, the parent does not plan to take the child in. What would you do? What facts might you share? Let's review. Poor oral hygiene and untreated dental diseases are linked to the following ailments: pregnancy complications, reduced self esteem, heart and lung disease, or all of the above. In this section, we will talk about common oral health problems that you can prevent through education, home care, and preventative care. First, we will talk about cavities, and then we will talk about gum disease. On the most basic level, cavities are just a hole in a tooth. Dental caries is what dental professionals call the disease that causes the cavity. What many people don't know is that cavities are caused by certain types of bacteria. So, just like any bacterial infection, dental caries can be passed from one person to another. That means that if someone in a family has active caries, they can pass it to another person in the family if they share utensils or toothbrushes, or if a parent touches a baby's bottle or pacifier with their mouth. You will learn later in this lesson that brushing and flossing can remove bacteria from the teeth, which lowers the risk of cavities. Just like cavities, gum diseases are also
It sounds like someone isn't muted, so if you are not muted, can you please mute yourselves? Thank you.
film that builds up on teeth. Plaque has lots of bacteria in it when you plaque and bacteria from your mouth. The milder form of gum disease is called gingivitis, which means that the gums are becoming inflamed or swollen. The more severe form of gum disease is called periodontitis. That's when the gums and bones that support the teeth are affected. Without treatment, periodontitis can result in tooth loss or sores in the mouth. When you go to the dentist, you may notice that the dental professionals will scrape your teeth with special tools. That's how they remove the bacteria-filled plaque from your mouth. Brushing and flossing are great, but they cannot get all of the plaque off of your teeth, especially if it is hardened. That is one reason why regular dental appointments are important, even if you do not have tooth pain. You've now learned about two common oral health problems: cavities and gum disease. What puts people at risk for these preventable diseases? There are a few important risks for you to keep in mind. One risk is lack of regular dental care. Remember, dental appointments are when dental professionals can remove the bacteria-filled plaque from your teeth with special tools, which toothbrushing often can't do alone. There are many reasons why people do not go to the dentist for regular care. They may not have insurance, or perhaps they do not realize that their insurance covers dental care. They may have transportation barriers or may lack child care. They may not be able to afford appointments even with insurance. They may also not really understand why regular dental care is important. Many people think that you should only go to the dentist if you have a tooth pain, and many people think that baby teeth are not important because they will fall out anyway. A second risk is home care habits. Not brushing or not brushing often enough can lead to oral diseases. Nutrition is important too. Sugary foods and drinks lead to the mouth becoming more acidic, which is an environment that bacteria likes. Medical conditions can create risk for oral diseases too. Many medications cause people's mouth to feel dry. These medications actually decrease the amount of saliva in people's mouths. A dry mouth increases the chances of cavities and gum disease. It's common for people to drink sugary beverages when they have a dry mouth feeling, but sugary beverages makes the mouth get even more acidic. Finally, a lack of fluoride can be a risk factor for oral diseases. Fluoride is a natural mineral that helps strengthen people's teeth and reduces their risk of cavities. People usually get their fluoride from two sources: tap water and toothpaste. When people do not have access to clean tap water, or when the community has opted not to fluoridate the tap water, this puts them at greater risk for oral diseases. When people do not use fluoridated toothpaste, perhaps because they do not see the value or they can't afford it, they lose a great opportunity to strengthen their teeth. You have now learned about two common oral diseases, cavities and gum disease, and some of the factors that put people at risk for getting these diseases. Now, let's talk about warning signs that an oral disease could be present. Because you are not a trained dental professional, it is not your job to diagnose any oral health problems, but you can recognize signs that something could be wrong and help the people you work with figure out how and where to seek dental care. Some warning signs to keep in mind are red, swollen, tender, or bleeding gums, bad breath that won't go away, loose teeth, sensitive or sore teeth, gums that pull away from the teeth, dry mouth, and mouth sores that won't go away. Here is another opportunity to consider what you would do. A person mentions that a few of her teeth are loose. She has not been to the dentist in many years. She says she figures she will have to get dentures because most people in her family have them. What would you do? What facts might you share? Let's review. What are potential risk factors for oral health problems? Lack of routine dental care, dry mouth, flossing daily, or poor toothbrushing habits. Now that you know a bit more about oral health problems, now let's talk about how to prevent them through home care and health care. People should brush their teeth at least twice a day. That morning brush is important, but even more important is that nighttime brush right before bed so that there isn't bacteria right up against the teeth all night long. We recommend that people spend about 2 minutes brushing their teeth so that a lot of plaque comes off. Be sure not to push too hard though. Some stores do sell very hard toothbrushes, but it's better to get soft or extra soft toothbrushes. The reason to get a soft toothbrush is that it's easier to damage the tooth and the gums with a hard or even a medium toothbrush. Many people are taught to rinse out their mouths to get the extra toothpaste out. You might be surprised to learn that we do not recommend rinsing after toothbrushing. We recommend spitting out the extra toothpaste and then not rinsing, eating, or drinking for 30 minutes after brushing. That allows the fluoride in the toothpaste to stay on the teeth to improve dental health. Flossing is important too. Brushing will get the food and plaque off the surfaces of the teeth, but won't clean in between the teeth. Flossing will help with gum health. Earlier in this lesson, you learned that sugary beverages cause oral health risk and should be avoided. They are acidic and cause bacteria to grow. The same goes for sticky foods like candy or potato chips. The problem is that for many communities, sugary beverages and sweet, sticky foods are difficult to avoid. They are inexpensive and they can be highly addictive. If people feel they do not have a choice but to drink sugary beverages and eat sticky foods, they can help protect their teeth by brushing teeth or even just drinking water afterwards, which can help wash away the sugar and acid. Avoiding these foods is preferable, but if avoiding them is not possible, rinsing is one way to lower the health risk. Here is another opportunity to consider what you would do. A person who takes a medication mentions that his mouth is dry a lot, and he does not know why. To help with a dry mouth, he drinks pop throughout the day. He says his gums have felt sore and swollen lately. What facts might you share with him? It's tough to motivate people to change their habits. What strategies would you use? What pitfalls would you avoid? Even before babies get their first tooth, parents can start supporting their kids' oral health. Before babies go to sleep, parents should wipe their gums with a soft, clean cloth. Parents should not put babies in the crib with a bottle, even if the bottle just has milk or formula in it. That is because sleeping with a bottle makes the liquid pool in the baby's mouth at night, which can cause cavities. Adding sweeteners to the baby's bottle at any time of day can increase oral health risks. When brushing kids' teeth, only use a grain of rice sized amount of toothpaste when the first tooth appears. When the child starts to be able to spit out toothpaste reliably, you can increase it to a pea-sized amount. Parents should help their kids brush their teeth until around 8 years old because before that, kids may not be coordinated enough to really get the plaque off their teeth. And remember, caring for your own mouth will help your kids too. It will decrease the amount of bacteria you have in your own mouth, and it will demonstrate to your kids how to maintain their oral health throughout their life. So far, we've talked about preventing oral health problems through home care such as brushing, flossing, and nutrition. But going to the dentist is important too. We recommend at least one dental checkup per year, even if there is no toothache for kids and adults. Baby's first dental checkup should happen 6 months after the first tooth comes out. You learned earlier in this lesson that when dental professionals scrape the teeth during a checkup, they are doing more with their tools than people can do with a toothbrush and floss from home. They also examine the mouth for treatable problems like cavities, gum disease, and even oral cancer. Encouraging people to go to the dentist for a checkup, even if they don't have a toothache, can help promote oral health. The problem, of course, is that many people do not have access to dental care. You learned earlier in this lesson that people may have low access to dental care for several reasons. They may not have dental insurance, or may not realize that they do have dental insurance through their current plan. They may have a transportation or child care barrier, or they may not fully realize the importance of dental checkups. They may not be able to afford a copay or the cost of a procedure because they need to spend their money on other things. When it comes to access to dental care, there's a lot we do not have control over. For example, we can't make dental care more affordable, and we can't fix a lack of public transportation options in a community. But there are a few things that we can do. We can help people figure out what their dental benefits really are. People may be surprised that some dental care is actually covered. We can help people find options for free or low-cost dental clinics. We can talk with people about the importance of oral health to help motivate them to take action. And we can also help address the stigma people feel when it comes to oral health. So many people feel shame about their teeth, and so many people fear the dentist, partly because of the shame they feel. You can make a difference in someone's life when you help them overcome any avoidance of the dentist that comes from stigma or shame. Many people also hate or fear going to the dentist. Some people will avoid dental care for so long that they get a tooth infection. This extremely painful condition often pushes people to an ER for treatment. It is important for people to know that an ER visit
Recording in progress.
is an underlying problem. ER treatment will be a temporary fix that can only be cured at a dentist's office. Here is another opportunity to pause and consider what you would do. You are newly hired at an organization, and you've noticed that your new employer does not do anything to promote oral health. What would you do? In this lesson, you have learned the basics of oral health. You now understand common dental problems and how to recognize them. And you have learned what people can do to prevent these problems. Perhaps, most importantly, we hope you have gained a new appreciation for the importance of oral health and quality of life, and gotten some new ideas for roles you can play in supporting the oral health of presents you with an amazing opportunity to make a difference by providing education, motivation, and linkages to dental care. Thank you for joining us today. And oral health. In this lesson, we will take a deep
Happy
dive
Friday, Baylor College of Medicine and friends of Baylor.
into the home care habits that support oral wellness. You will learn specific oral health tools such as fluoride wellness. You will learn how these tools can be used with proper technique, and you will learn how to teach others about these tools and techniques. What you are about to learn about keeping the mouth healthy might surprise you, even if you've been to the dentist many times in your life. The main take home message in this lesson is that what people do at home is the number one factor in keeping their mouths healthy, and that it is never too late to improve oral health. You'll notice a special feature of this lesson is that there are a few opportunities to pause and consider what you would do in particular situations. When a what would you do slide comes up, feel free to pause the presentation for individual thinking or a group discussion. Part 1. What are the home care tools? We will learn what the recommended home care tools are and how they should be used to support oral health. One of the most important tools in your oral health wellness toolbox is fluoride. You might have heard about fluoride before, but today we will take a closer look at this natural mineral that helps strengthen people's teeth and lowers their risk of oral diseases. When used the right way, fluoride is not dangerous. In fact, fluoride is seen as one of the biggest public health successes of the 20th century. People usually get their fluoride from two sources: tap water and toothpaste. Let's start with tap water. Fluoride is added to many community water sources, giving fluoride access to millions of people throughout the U.S. Even so, there are several reasons why people may not have access to fluoridated tap water. There might be problems with the quality of local tap water, which forces communities to drink bottled water instead. Also, some people get their water from a well instead of the tap, especially in rural communities. Finally, some communities are fearful of fluoride and have opted not to fluoridate their water. Fluoridated water helps strengthen teeth enamel when the teeth are still growing, but it can be a problem in high amounts. A dental provider can help with advising patients about the right amount of fluoride for children. Next, let's talk about toothpaste, which is another important source of fluoride. When people brush their teeth with fluoride toothpaste, they are placing fluoride directly on their teeth. Brushing with fluoride toothpaste is a great way to access fluoride. But just like with tap water, there are several reasons why people may not have access to fluoride toothpaste. They might have a low income and need to spend their money on other purchases. They might not realize the value of fluoride toothpaste. And they might have heard from friends or read on the internet that fluoride is dangerous. When working in communities, one of your roles can be to understand the barriers people face in accessing fluoride and to help them overcome those barriers. You can also help people come up with questions about fluoride that they should ask their dental provider. Here is an opportunity to pause and consider what you would do in a particular situation. A person says that he read on the internet that fluoride is dangerous, so he only buys fluoride-free toothpaste that he says is more natural. What would you do? What facts might you share? Now that we've talked about fluoride, let's move on to toothbrushes. Toothbrushes are a very important tool in the oral health wellness toolbox. Over the course of the day, the teeth develop a sticky layer of something called plaque. Plaque is filled with the bacteria that eventually causes cavities and gum disease. So it's important to brush off that plaque every day. Toothbrushes can be purchased at a pharmacy, dollar store, or a grocery store. Different toothbrushes cost different amounts of money, but a cheap toothbrush can be just as effective as an expensive one. The main thing to look for is how soft the toothbrush is. Some stores sell very hard toothbrushes, but it's best to get a soft or extra soft toothbrush. The reason to get a soft toothbrush is that it's easier to damage the tooth and the gums with a hard or even a medium toothbrush. Toothbrushes can be used on children as soon as their first tooth appears. Before babies get their teeth, their gums can be wiped using a soft, clean cloth. We wipe a baby's gums for the same reason we brush teeth, to remove the plaque and bacteria that can later cause cavities in their teeth. Now that we talked about toothbrushes, let's move on to toothpaste. Earlier in this lesson, you learned that fluoride is a natural mineral that helps strengthen people's teeth and lowers their risk of oral diseases. You might be surprised to learn that the main reason we use toothpaste is to apply fluoride directly onto the teeth. Just like toothbrushes, toothpaste can be purchased at a pharmacy, dollar store, or a grocery store. And also, like toothbrushes, different toothpaste cost different amounts of money. But cheap toothpaste can be just as effective as expensive toothpaste. The main thing to look for in a toothpaste is whether it has fluoride. We do not recommend using toothpaste that has no fluoride. Also, avoid toothpaste made from charcoal. We also do not recommend making homemade toothpaste. Toothpaste should not be used on babies. Once children are older, grain of rice-sized smears should be used until the child is old enough to spit out the toothpaste. Here is another opportunity to pause and consider what you would do in a particular situation. A person says she cannot afford the toothbrushes and toothpaste available at her local pharmacy, so she does not brush her teeth. How would you start a conversation about this problem? What facts would you share? So far in this lesson, you have learned about fluoride, toothbrushes, and toothpaste. Another important tool in your oral health wellness toolbox is dental floss. You have already learned that plaque builds up on the teeth throughout the day and sticks to the teeth. Plaque is filled with the bacteria that causes cavities, and that brushing plaque off the teeth is important to oral health. But toothbrushes can't get between the teeth, which is where many cavities can start. That's where floss comes in. Flossing can scrape some of the plaque out from between the teeth, which means there is less bacteria in the mouth and less of a chance for oral diseases. Finally, let's talk about mouthwash. Mouthwash is not just a mouth freshener. Earlier in this module, you learned that the sticky plaque on people's teeth is filled with bacteria. Those bacteria can cause cavities and gum disease. So our overall oral health home care tries to lower the amount of harmful bacteria in the mouth. Mouthwash can help kill the bacteria that can cause cavities. Like toothbrushes and toothpaste, you can find mouthwash at a pharmacy, grocery store, or dollar store. Some mouthwashes contain fluoride, giving extra protection against cavities. So far in this lesson, you have learned about fluoride, toothbrushes, toothpaste, floss, and mouthwash. Many people want to know what is the most important thing we can do to take care of our oral health. In a perfect world, everyone would use all of these tools, but we realize that people do not always have enough money, time, or patience to do it all. So, if someone has to choose, they should be sure to brush the teeth every day with fluoride toothpaste. Part 2. How should people use the home care tools? So far, we've talked about the most important tools in your oral health wellness toolbox: fluoride, toothbrushes, toothpaste, floss, and mouthwash. Next, we will talk about how to use these tools. Believe it or not, there is a right way and a wrong way to use each of these tools. Brushing is an important part of preventing dental problems for all ages. The teeth should be brushed at least twice a day with a soft or extra soft toothbrush and fluoride toothpaste for 2 minutes. This helps to remove food and plaque. And fluoride toothpaste helps protect the teeth from cavities. It is important to brush before bed and after waking up because when we sleep, plaque builds up. Removing plaque by brushing it off is the most effective way to reduce it. Brushing the tongue also helps reduce the amount of plaque in the mouth. To brush the teeth, people should hold their brush at a 45-degree angle where the gums meet the teeth. They should gently brush with short, soft strokes from the gum line to the chewing surfaces of the teeth. They should be sure to brush all the surfaces of the teeth, including the chewing surfaces. They should also gently brush the tongue to remove plaque. People should brush their teeth for 2 minutes each time. Using a song or a timer can help encourage brushing for the full 2 minutes. Too much brushing can also cause trouble. Brushing too hard can cause receding gums and bleeding, and might cause the teeth to become too sensitive. Toothbrushes should be replaced every 3 or 4 months, or sooner if the bristles are flattened or if the person is ill. Toothbrushes should not be shared because that could spread the bacteria that causes cavities or other illnesses. A smear of toothpaste the size of a grain of rice should be used for children who cannot spit out toothpaste on their own. For older children at around the age of 3 and adults, a pea-sized amount of toothpaste is enough. It is important to not let younger children eat or swallow too much toothpaste. One strategy to make sure kids don't eat toothpaste is to use a strong minty flavor instead of a fruity or bubblegum flavor. People should not rinse their mouths after brushing because this rinses away the fluoride. People should spit out as much toothpaste as they can and try to avoid eating or drinking for 30 minutes after so that the fluoride can be effective. Dentures also need daily care to keep them clean and the mouth healthy. Dentures should be removed and rinsed after meals, in addition to be removed and soaked nightly. This is an important step in maintaining the dentures and a healthy mouth. It is important to remove plaque and food from dentures. People should also remove any denture adhesive from the dentures every day, as it can trap bacteria. After removing the dentures, people should brush the dentures with a soft toothbrush and a denture cleaner. Denture cleaner is not meant to be used in the mouth, just on the dentures. When people soak their dentures in denture cleaner, they should be sure to rinse them really well before wearing the dentures. Dentures should not be in the mouth overnight so that the tissues in the mouth can breathe. Not removing dentures at night can potentially result in problems like yeast infections in the mouth. Also, people should not use whitening products on the dentures. Now, you've learned how people should clean their teeth or false teeth, but even toothless mouths should be cleaned every day. For example, babies with no teeth should have their gums cared for every day. After feeding, babies' gums should be gently massaged with a clean, wet cloth. According to the American Academy of Pediatrics and American Dental Association, a baby's teeth should be brushed as soon as the first one erupts in the mouth, which is usually around 6 months.
Hello, if you're not muted, please mute your phone or your computer. We're getting a lot of background noise. Please make sure you are muted. Thank you.
Adults without teeth should also clean their mouths. A clean, wet towel should be used to wipe the gums to remove food and bacteria, and the tongue should be brushed. Using a mouth rinse can also help remove bacteria and help with fresh breath. Here is another opportunity to pause and consider what you would do in a particular situation. A person you work with has a new baby. You are not sure how much they know about caring for a new baby's oral health. What questions would you ask? What facts would you share? Now that we've talked about brushing technique, let's move on to flossing technique. Flossing is an important part of keeping teeth healthy. People should actually floss before they brush. When done the right way, flossing can help loosen and remove food and plaque between the teeth that can then be brushed away. Here's the way to floss. First, gently wrap the floss around the middle of the tooth and hold with the thumb and index finger of both hands. Then, put the floss between the teeth. Wrap the floss in a C shape around the one tooth, being sure to drag the floss down under the gums until there is a gentle resistance and then up. Then wrap the floss in a C shape around the neighboring tooth and do the same. Remove the floss and insert between the next two teeth and repeat. Unwrap floss from the fingers to use clean sections of floss. Children's teeth should be flossed too. There are flossing aids that can make it easier to floss children's or adults' teeth. Part 3. What is my role? So far, we've talked about the most important tools in your oral health wellness toolbox: fluoride, toothbrushes, toothpaste, floss, and mouthwash. We have also talked about how to use these tools. Now, let's talk about your role in all of this. How should workers such as yourself help people make the best use of their wellness tools? When you work in the community, you will probably meet many people who haven't taken care of their oral health for a very long time. You might meet adults or children with severe decay and tooth pain. You might meet adults with few teeth or no teeth at all. Maybe they're thinking, it's too late for me to improve my oral health. I might as well give up. Or maybe they're thinking, I'm afraid of the dentist. In fact, I hate the dentist. I'm not going unless I have to. The bad news is these worries can stop people from making changes they need to make to improve their health or the health of their children. And the shame people can feel about their oral health can make the situation even worse. The good news is it's actually never too late to make positive changes. When you work with a community, you can play a very important role in someone's life. If you help them see that it's never too late. Scientific evidence has shown that if people start taking care of their oral health can improve no matter how old they are. If you can help someone see the value of brushing their teeth, or help someone overcome barriers to brushing their teeth or seeking dental care, you can make a huge difference in their life. Besides helping community members see that it is never too late to make positive changes, you might want to share some of the information you have learned in today's lesson. You can share information about buying a soft toothbrush, or about why fluoride toothpaste is a good thing, or about wiping toothless gums with a soft, clean cloth. You can even tell them about brushing technique. Right now, you might not remember all of the information we share with you today. That is perfectly okay. You are not expected to memorize all the information in today's lesson. If you are interested, you can go back and replay some of the topics you heard today, or you can look online to learn more. Here are 2 websites that are very helpful when you need to refresh your memory about oral health topics. The Colgate website has a tab called Oral Care Center. Under this tab, you can find information on topics such as oral health at different life stages, nutrition and oral health, brushing and flossing, dentures, and dry mouth. Remember, as a community worker, it is okay to say, I don't know. If a person asks you for specific guidance about a topic, like the properties of fluoride or toothbrushing technique, it is okay if you do not remember or if you do not feel comfortable giving health advice. You should only provide information that you feel confident about. If health education is not part of your scope of practice or level of comfort, you can give people oral health flyers or brochures from sources like the American Dental Association. Or you can help people find a dentist that takes their insurance and help them solve any barriers to getting there. Here is another opportunity to pause and consider what you would do in a particular situation. A person you work with has severe tooth decay. After many years of not caring for their teeth, they feel ashamed of their teeth, so they do not bring it up very much. But once in a while, they do mention something about their bad teeth. What would you do? What facts might you share? How would you address the shame or stigma they feel? In conclusion, this lesson has shared many facts about the home care habits that support oral wellness. You have learned about specific oral health tools, such as fluoride and toothbrushes, and you have learned how people can use these tools with proper technique. Take a moment to think about whether anything you have learned today has surprised you. You make a huge difference in someone's life by helping them address barriers to proper home care. You can improve someone's knowledge of oral wellness tools, which may help them see the value of home oral care. And you can help people find affordable oral health wellness tools and make smart choices about which ones to purchase. In the community where you work, you might already know where to find the local food pantry or medical clinic. Wouldn't it be a great addition to your work in the community to also know where to find affordable oral health wellness tools like toothpaste, toothbrushes, and floss? The main take home message in today's lesson is that what people do at home is the number one factor in keeping their mouths healthy, and that it is never too late to improve oral health. If you help someone see that it is not too late, you can make a difference in their life.
Okay, great. Thank you everyone for sticking with us to watch the modules. We appreciate your time. It is now currently 11:51. We have a few minutes for a brief Q&A. So if anyone has any questions for James at the University of Michigan, he's the project manager of the Oral Health Project in the Department of Psychiatry. Please let us know. Let's see. I'm trying to see if there are any questions. You can always put them in the chat and we can read them, or you can unmute yourself. I'm trying to see if there are any questions in the chat. I don't see any, so we'll just give it just about another minute. I wanted to take some time to remind you to fill out our webinar survey. The link is in the chat. It is on SurveyMonkey. If you complete that webinar survey, submit that, give us about a week. We will send you a certificate that you can upload to your profile. We do have a question. James, is it possible for you to discuss the water jet method of cleaning your teeth? Are you familiar with the water jet? Any of the pros, cons, benefits, etc.?
Yeah, so I don't have a background in oral health, but that's something that I can definitely pass on to our dental hygienist, Danny Rowley. So I can definitely get her perspective on the water jet cleaning.
Okay, great. Carolyn, we can email you. If you share your email address with me, or you just change your chat from everyone to just me, then we can send the answer to that question over to you once we get that from James. Does anyone else have any more specific questions for James? If not, please don't forget to fill out that webinar survey. Tomorrow, there is another webinar entitled Not Defined by You, regarding labels and language when dealing with clients with mental health issues. That's hosted through Bridging the Gap and DWIN. So you can contact them directly to register for that webinar. I will be there moderating. Our next MiCHWA hosted webinar is on June the 4th. That is the one that is on infant safe sleep. So please save that date. Go over to Eventbrite. Again, we close registration for these webinars 24 hours prior. If you're emailing that morning or during the webinar, we are already inside. We will not get those emails. It's very difficult for us to help you because the person or people who would do that are already in the technology and don't have access to view that. So if you need to come to the webinars, you need to register 24 hours in advance. Tomorrow, we don't have an event, Bridging the Gap does, but if you go through your email or just Google Bridging the Gap, Michigan webinars, you should be able to find those and register. So if there are no more questions, I'm just going to take a moment to thank Nicole for helping us to host the webinar, to thank James for helping us to present and giving us a little bit of background on oral health. I want to give everyone the opportunity to unmute themselves to say goodbye and thank you. And we look forward to seeing you either tomorrow at the Bridging the Gap, which is hosted by DWIN, or at our next MiCHWA hosted webinar, which is on June 4th. Thanks, everyone. Have a
Bye, everyone.
Thanks, everyone.
Goodbye.
Bye-bye.
Thank you.
Bye-bye.
great seeing everybody.
Yep.
Bye, guys.
Well, let me go in here. Get out of here.
Thanks, James. I appreciate it. Send me over that water jet info if you get the chance, and I'll forward that to Carolyn when I get it from you. We appreciate
Sounds
you.
good.
Oh, Dr. Lapidos, I said hello and thank you.
Will do. All right, thanks. Bye.
Bye, everybody.